To start with Jeanette Ignacio, and the title of her thesis is Stress Management in Crisis Event Simulations for Enhancing Performance. And she just finished her PhD thesis, which is now being assessed by the committee. Jeanette, it's your turn to start.
Okay, good morning, everyone. Good afternoon, everyone. Yes, I'm actually here in Singapore, so now it's like late afternoon here. I'm going to present to you what I did for my PhD thesis, and it's, as Diana mentioned, it's titled Stress Management in Crisis Event Simulations. Now, I wanted to make all my slides very simple, too simple, in fact, that I didn't put my name on it as well as my institution. Well, I come from the National University of Singapore, from the Alice Lee Center for Nursing Studies, Yong Lu Lin School of Medicine. Now, to begin with, I'd like to give you a preview why I decided to come up with this project. Okay, so we all know that there's a lot of stress in the clinical area. And as studies mention, this stress actually trigger emotional responses in the healthcare professionals that may actually affect the way they manage their patients. So it actually affects decision making, it affects, in general, patient care as well as patient outcomes. Now, what also is in literature is that, stress and emotions are definitely interlinked. So we have evidence that when people are stressed or when they're very emotional, they become stressed, and vice versa. So it's there's a close link between emotion and stress. And studies also show that stress involves not just emotional outbursts or emotional responses, but there are physiologic signs that actually people manifest that tell us that the person is actually stressed. Now, how is stress related to performance? As mentioned earlier, stress can affect performance. And studies have different say. Studies say that stress is good, where performance. However, what we found consistently in literature is that there is this correct amount of stress that actually motivates a person to improve performance. And at excessive amounts, this stress can actually impair performance. And therefore, when it impairs performance in the clinical setting, what happens is, of course, it will affect patient management. So what has been suggested by some researchers is that there should be some stress management training for people who are into the healthcare profession, such that when they deal with actual stress in the clinical area, they will not be or they will not actually affect their performance. Now, simulation. Why do I talk about simulation here? Well, generally, simulation is a pedagogy, a type of methodology that we use to train students. But we train students or generally what we use simulations for is training students on skills, or technical skills rather. It provides them with hands-on experience in managing patients in real-life scenarios, or not real-life scenarios, but simulated scenarios that actually mimic real-life settings. So during this hands-on training, there is some degree of emotional involvement, because students usually get stressed, or trainees get stressed when they actually participate in this simulation exercises. Now, it has been suggested that it will be good if we not only use simulation training for training skills or technical skills, but we also use simulation training to train emotions. Why emotions? Because emotional responses can actually affect patient outcomes, and stress is one form of emotional response. So the aim of this thesis overall is to develop this emotional training strategy that focuses on stress management. There are several emotions that we can focus on, but because stress is something that we find a lot of in the clinical area, so we decided to focus on this emotional training that's related to stress management. So we want to integrate a stress management technique in the training of healthcare professionals. And because, as I've said earlier, it's actually good to have it in the simulations, because in simulations you have a real environment, a simulated environment that's very real, or that allows students to practice in situations where they feel that the environment is quite real. So a stress management technique integrated in that setting will actually be good, because the realism actually increases, or if the environment is very real, then the emotional responses that are elicited from the students will actually be more or less real. So it mimics the emotional responses, or when we want to say stress, the stress that they will actually feel in real life settings. Now, this is an overview of my research project. So generally, I have 4 research questions. The first is, what strategies are used to reduce trainee stress during crisis event simulations, and what is known about their effectiveness? So for this part of the study, what I did was actually a discussion paper and a literature review to find out what really are the strategies being used, particularly in health professions education. We find a lot of studies that actually talk about technical skills training, but there are very less studies that focus on non-technical skills, or the softer side, or what others call as soft skills, such as stress management. The second research question that I have is, what are the effects of using standardized patients versus high-fidelity simulators on student performance and stress reduction? To answer this question, I actually did a randomized controlled group pre- and post-test design study, and then this was followed by a focus group interview. Now, as we go along, I'll be talking about how I did all these studies one by one. The third research question is, what are the effects of a developmental rehearsal strategy on student performance and stress reduction? And for this, I actually did a 1 group pre- and post-test, plus, again, focus group interviews. And the last question is, what are the effects of an improved mental rehearsal strategy integrated into simulations on student performance and stress reduction? For this, I did a randomized control group post-test only, and I didn't do focus group interviews, but for this one, okay, so as I've mentioned, primarily we did literature review, and what we found was that there are very limited studies on stress management, particularly in health professions training, and also in simulation. So the studies that we found, actually, there have been studies, however, but these studies, uh, the results of these studies were actually quite, well, non-conclusive, because certain studies actually showed that the interventions that they did were effective, and some the interventions were not effective. So what did they use? So what we found was, when they reduced stress, so they integrated certain strategies, particularly mindfulness training, progressive muscle relaxation, and mental practice. So these were the common strategies that they used and tried to incorporate in their simulation training to actually produce better performance. Now, uh, because the literature actually showed varying results, uh, this literature actually suggested that this was because of uh, various factors, because as we know, a lot of factors can affect stress. Here we're talking about acute stress, but certain factors such as family life, friendships, and all this could actually add on to the acute stress that a person might be experiencing during a simulated practice session. Now, what stood out actually during this literature review, what stood out was these two these two techniques that were used: imagery and repeated exposures. When I talk about imagery, it's generally mental practice. So mental practice or mental rehearsal has been shown by some studies, particularly studies used by surgeons to train for skills such as laparoscopic cholecystectomy. So they found that these strategies, imagery, and then of course when you repeat multiple sessions, actually were quite effective in reducing stress. The second question, which I think I'll be talking more about, would be this use of standardized patients. So why did I try to do this study? Is because we thought that because simulation training is actually allowing students to practice in realistic environments, now to make the environment more realistic, we actually needed to bring in standardized patients. So as if you remember initially, I mentioned that we actually elicit a similar response as the response in the real setting when we actually increase the reality or the realism of simulation. So here we thought that, or literature actually mentions that the use of standardized patients can actually make the scenarios very real, such that the emotions that the students show would actually be very similar to what they would show or what would be elicited from them in real life settings. So we wanted to compare really if there was an effect if we increase the realism. So what we did for this study is basically we compared SPs versus high fidelity simulators. So what we did was we had simulations, exactly the same scenarios so students were randomized into these two groups, the SP group and the high fidelity simulator group. And what happened was students were randomized into these two groups, and the scenarios for both groups are actually very, very similar. The only difference is actually just the SP. The scenario, the case study, everything was the same, except that the other group had an SP acting out, and the other group had a mannequin. Now, what we measured for this study was actually salivary alpha amylase. So we decided to use salivary alpha amylase because apparently it's a good measure of stress, acute stress in particular. However, during the study, it was that we found a bit of difficulty because students actually, the process of getting the saliva is not that easy, and sometimes the students, it takes time for some students to actually produce the saliva that we're going to use as a sample, because there are different ways by which we actually could get the amylase from the saliva. However, the method we used, or the method that our laboratory uses, is actually the one that uses saliva via drooling. So the students were asked to actually drool out the saliva in a test tube. This has, I figured after that it had some limitations because some students had a very difficult time doing so. And so because amylase, salivary alpha amylase, actually sort of rapidly decreases. So it increases immediately after acute stress, then rapidly decreases. So that was one issue that we confronted for the study. And so in the end, what we found was that after the participants actually went through the simulation, so we took the saliva and we measured salivary amylase. So we did it before simulation and after simulation. The results actually showed that there was generally no difference. I guess, as I mentioned earlier, several factors could have come into play, and one of which was the difficulty in getting the saliva sample that we wanted to analyze. Now, after this session, the students were actually, so I forgot to mention, I'm so sorry, that the students were actually year 3 nursing students, and they were actually doing this study as part of their module, a clinical decision-making module. So part of this module is to run simulation. So that's why we were able to run this study in that particular module. So after that module ran for a semester, the students were asked to go to clinicals. So they had their first clinical experience. So after this clinical experience, we did focus groups and asked the students how they actually perceive the simulations with SPs help them, or the simulations without SPs helped them during their clinicals. And what we found was that even though initially we didn't find any improvement in stress, or any changes rather in stress between the SPs and the high fidelity simulator group, as well as performance. Performance was actually the same. We have a performance checklist. It was basically the same. But in the focus groups, it was quite interesting how the students actually the value of having SPs, because they said that the SPs actually help them deal with actual patients, and they had some experience with deteriorating patients as well in the clinical area. And so being able to communicate the way they communicated, for instance, with the SPs, actually helped them lessen the stress as compared to actually not having the experience with the SPs. So generally, it was noted that interacting with SPs were perceived by students to be more helpful in the performance of their clinical skills. So the next research question, this was another study. So after a year, we actually conducted another study, and this was in the same module, the clinical decision making module, which was again for nursing students, final year nursing students. And here, because based on literature review, we found that mental rehearsal or mental practice actually was effective. So we tried to develop our own mental rehearsal related to assessing and managing deteriorating patients. So when we developed this mental rehearsal strategy, we asked experts from the clinical area to go through with us, what are the steps that are needed for students to actually manage deteriorating patients. So basically, we worked on the ABCDE framework, but we also got input from the clinical people. So they validated this mental rehearsal strategy. So here, what we did was a pre and post. So a pre and post, only a few students participated because this was done immediately after the semester. So we had 18 students participate, and what they did was actually to go through a mental rehearsal script that we developed based on feedback from clinical people, or the mental rehearsal script that was validated. They also watched the video on how an ideal management of patient deterioration should be done. Plus, before this mental rehearsal, what they also did was to actually have their own relaxation technique, because studies have shown that when you're relaxed and you do mental rehearsal, then it will be more beneficial. After this, they were asked to do a post test. So after the intervention, the mental rehearsal intervention, they were asked to apply or go through a simulation on deteriorating patients. And after that, we actually measured. So we measured their blood pressure, we measured their heart rate, as well as we made them do or answer a subjective or a questionnaire, the state trait, anxiety inventory. And after that, what we found was actually there was an improvement in performance, but stress levels were actually not improved. There was no statistically significant improvement in the performance of students after this mental rehearsal strategy. It's only the performance that improved, but stress rather did not improve. Again, we actually did a focus group interview because this was at the end of the semester, the quantitative part. They went to clinicals. They had their clinical posting, and after this, they went back and we did focus group interviews. During focus group interviews, what we found, again, was that they really enjoyed having this mental rehearsal because they found a lot of value in it. They said that, it would be good if this mental rehearsal can be integrated into simulation. It would be good if it started early. So they had very positive views about this mental rehearsal because they said that during their clinical posting, they felt that they knew how to handle patients more, deteriorating patients more, because they were used to practicing this mental rehearsal. So they suggested that we integrate it into realistic simulations. So the last research question, what are the effects of an improved mental rehearsal? Why do we say improve? Because the mental rehearsal that we created initially, that has been validated by clinical people, has been improved based on student feedback. So from the previous study, we actually improved this mental rehearsal. And now what the difference is that we incorporated it into simulation. That actually use standardized patients. So we took the students' advice and improved the mental rehearsal and integrated it into simulations. So what we did is we actually had this intervention, and after this intervention was given to the student, so we did a randomized control wherein one group of students actually had this improved mental rehearsal in simulations, when the other group of students actually didn't have this, but had a standard way of learning how to manage deteriorating patients, which was to actually use a mannequin, to practice simulations using a mannequin, having the ABCDE framework in mind. So they didn't have this mental rehearsal script, they didn't have the mental rehearsal protocol, they only had simulations and the knowledge of ABCDE. So post-test, we actually checked again performance and stress, and this time we didn't see any improvement in performance. There was also no improvement in stress. So stress levels did not decrease. Performance also did not improve. As compared to the previous one where we only did the mental rehearsal, we saw that performance did improve. Now, after this, again, the students went into their clinical posting, and when they came back, we did individual interviews. And again, contrary to what was the result of the quantitative part, we found that students actually, again, valued this mental rehearsal strategy in simulation with the SPs, because they said they were able to prepare themselves mentally and emotionally for the clinical area. So some actually thought that this was very good because this strategy that we used actually helped them remember information, because they can visualize, they can remember a story, and so they thought that it was beneficial for their clinical practice. Now, overall, my study would have a lot of strengths and limitations, and I personally, well, I think that, due to time constraints, I cannot really discuss extensively. However, my study was actually programmatic in a sense that it actually was results-based. If you remember, we did literature review, and then initially we wanted to test realism. So we tested realism, we chose an intervention, and combined these interventions to produce this mental rehearsal strategy and simulation that was the end product of this study. But of course, we know that this strategy needs a lot more of improvement, and perhaps future research can actually do that. And I've used mixed method design for the 3 experimental studies, and it's quite interesting because the results usually, or the results of these 3 studies that use the mixed methods did not actually jive. The quantitative usually is not very favorable of the intervention, whereas we get student feedback, or we get their feedback on how the intervention worked for them in the clinical area, and they have very positive response. A limitation, I guess, of the study is the number of simulation exposures. If we had multiple simulation sessions, then it would have made a difference in terms of stress, in terms of performance. Because stress, studies show that if you expose repeatedly, then inoculation takes place. So students sort of get used to the stress, so they are able to manage the stress more. Now, also a limitation would be the characteristics of the measures used. As I said initially, we used salivary amylase, which was very difficult to do. And then later on, we tried to use the STAI, as well as blood pressure and heart rate monitors. Then, of course, I have varying designs. One was a randomized pre-post. The other one was one group pre and post. And the last study was actually a randomized post-test. Okay, So I guess to explain why I used the randomized post-test in the last study was because we thought that the previous study, which actually used just the pre and post, which had improved performance, we were thinking that maybe performance, because the pre-test could have actually confounded the result, because the pre-test simulation actually is considered a simulation in itself, and so it could have improved the students' performance scores post-test. Okay, so I think this is my last slide, the implications to health professions education. So basically, I mean, the study, the strategy is not perfect. It needs a lot of refining, a lot of things, a lot of, I guess, studies need to work, a lot of things need to be worked out. However, we feel that, there is really a need to have this training to help students or to help trainees, health professions trainees manage stress, because it's a constant threat to their well-being, to the well-being of their patients, because it translates to better practice, because too much stress would actually, impair their performance. So the strategy actually has the potential to help learners integrate information and skills, particularly because we do it in the simulation setting, then it can be translated to actual clinical settings. And also the principles that are derived from this MR strategy can actually be used in training other health professionals. I used it in nursing students, but however, the principle of mental rehearsal, it has a lot of potential. So other professions can actually use it in their training. And it's quite easy to do, easy to use in that sense, because once the script, the mental rehearsal script is developed, then the trainees can have a copy and they can practice on their own. Okay, and then of course this has to be augmented with actual simulation practice later on. So my conclusions, I have conflicting results, but what I found was that the realism by means of FPs and MR strategy have some benefit in training for stress management. And stress, if you look at literature, is a very complex concept, particularly in health professions. So research studies actually have very different results sometimes. So a lot more needs to be done in order to actually look at how we can better manage stress. And I guess the MR strategy, or the mental rehearsal strategy rather, may be a way to do that. Okay. So I'd like to end my presentation, and I'd like to thank my supervisors, Diana, Albert, and Yan Yu. Thank you very much.
Jeanette, thank you very much. Given the time, we have limited time to ask questions. And there was one question raised by someone who was attending this presentation at a distance. And Sanne is going to repeat the question.
Yeah, the question was by Weiming, and she wants to know the number of participants and the duration of study 2.
Of study 2. So the number of participants, study 2 is the pre and post, the one group, the single group pre and post. So this actually was participated in by just 18 students. So it's not a very big sample, considering the class size was around, I think at that time around 70, yeah. But because we had very want to participate, because this was done immediately after the semester ended. So I guess we